We are going to be talking about understanding how to best take care of you during your transition to motherhood. My name is Jenna Kahlo. I am a physical therapist at Body Dynamics, and I am joined by Natalie Rakestraw, who I think you can see at the bottom there. I'll kick things off, but you're gonna hear from her in a little bit. All right, so our objectives today, we are going to review the body changes during pregnancy, discuss new demands of motherhood, identify common postpartum complaints, point out factors that influence pain, provide tips for managing new physical demands, and offer some guidance on postpartum physical activity and exercise. Okay, so a quick little disclaimer, this information is intended for educational purposes only, and it's certainly not meant to replace any individualized evaluation, treatment, or exercise prescription. So changes during pregnancy, most, if not all, of our body systems have changes during pregnancy in order to support the growth and development of the baby. This is a very brief list, not to dive into detail because we're not medical doctors directly treating some of these things, but the purpose really here is just so we can appreciate truly how super our moms are before birth even occurs. For some that have already had their little one, you might be refreshing your memory to some of what you experienced, and maybe for others, you are going through this right now. So this is, again, not an all-inclusive list, but you can see that many of the typical body functions will be affected. So starting with the endocrine system, which is going to have hormonal changes. So for example, one hormone called relaxin is what helps allow for laxity in the ligaments, which support our joints. In the next slide, we'll talk a little bit more about how that's going to affect our musculoskeletal system. Our GI system, you might experience nausea, vomiting, reflux due to some of those hormones, and then also due to some of the relaxation that can occur to some of the sphincters that we have that hold food down. The respiratory system, which has to do with our breathing, that houses the diaphragm, which is a dome-shaped muscle that lives underneath the rib cage. And as the baby's growing, it actually shifts upward to make room for the baby. And that can contribute to how you feel when you take a breath in. Again, we'll talk a little bit more about that later. The cardiovascular system, which deals with pumping oxygenated blood, some changes that might occur, you might be retaining water, you might have you're going to have an increase in blood volume to nourish the baby, and your resting heart rate might go up. And then as the baby continues to get bigger and pushes on your bladder, you might experience some urinary frequency. And lastly, on here, we have the metabolic system. So on average, there's about a 20 to 25% increase in body weight. So these next set of changes here, they have to do with our musculoskeletal system, which is made up of bones, ligaments, tendons, and muscles. And those are the tissues that allow for human movement. So again, this is not an all-inclusive list, but it's really just so we can appreciate the gradual change that occurs in preparation for birth. And as PTs, we get most excited about this because this is kind of our bread and butter dealing with the musculoskeletal system. That's our job, to help people feel and move better. So starting at the top, we have the rib cage, which that's actually going to expand, and if you kind of put your hands on your rib cage, it would move out to the side or even move forward, all in efforts to make space for that growing baby. And then the ligaments that hold the bones together, specifically around the pelvis, those are going to loosen as well to expand and prepare for birth. The rectus abdominis muscle, so that's the muscle that goes from the bottom of your sternum and travels right down the center of your belly and attaches onto the top of your pubic bone. This can actually start to gradually spread during birth as well as the belly's growing. Some postural changes can occur. So with all the growth that's happening forward, there's a shift in gravity, the center of gravity, and moms will also sometimes have to counteract in order to prevent literally from tipping forward and place just extra load and stress into their low back. The feet will spread sometime between like 12 and 24 weeks. And you may notice or have noticed that the way that you're walking is different. So anytime a change happens in your musculoskeletal system, and this part's not unique to just pregnancy, whether or not that change is from pain or discomfort or stiffness, or really even something getting more relatively loose, the human body will develop what we call as PTs a compensatory strategy. And essentially what that is, it's really just so you keep on moving, right? Like you're just gonna keep trying to go through your day. You might not even notice it. One example of this might be your pregnancy waddle that people call it, where, the mother-to-be starts walking, with their feet out to the side. They have that wide base. And it's really because, and they're maybe swaying side to side more than front to back, because they've lost some of that motion or ability to do that motion. So with this, really what we're trying to say is that it's important to note that some of these movement compensations that were developed for very good reason during pregnancy, they might continue even after you've had your baby. And they might need a deliberate effort or encouragement to get back to what we would kind of deem more as like normal or healthy movement. So it's just something to keep in mind. All right, so moving on to the 4th trimester. So this refers to the 12-week period immediately following the birth of your baby. In May of 2018, there was a committee that is put together by the American College of Obstetricians and Gynecologists. They're also known as ACOG. You might have heard of them. They put out a revision to their recommendations for postpartum care. And what they did was they emphasized the importance of this period, and they proposed suggestions of how to optimize care during this time. So some of the highlights, it stated that the weeks following birth are a critical time for the infant and mother, and they set the stage for long-term health and well-being. The paper emphasized that optimal care should be an ongoing process versus just a single encounter, and should include services that are tailored to the individual. They recognize physical therapists as having a role with pelvic floor dysfunction or movement dysfunction. So that was really great to have that be recognized, just because I think after you have a baby, all the focus just kind of shifts to this new life, which is a beautiful thing, but we got to make sure we take care of our mamas too. So from a PT perspective, although this period has somewhat of a defined time frame, you may feel like you're still sorting through some functional challenges that are well past 12 weeks after you've had birth. And that's going to come from a combination of the new demands as being a mother, changes that you might have had during pregnancy, and then also changes from birth. So these are some considerations for what you want to keep in mind during recovery. This information is not to replace any instructions that you were given post-birth when you were discharged from the hospital or maybe from your care team, but it can just shed light on why recovery is so unique. So some of the things to keep in mind are whether or not you had a vaginal birth or a C-section. So for instance, with a C-section, that was major abdominal surgery, and it's recommended that you shouldn't really lift anything heavier than your newborn for about 6 to 8 weeks, really in order to protect that incision site and allow for healing. The length of time of labor and birth, that's going to influence, how those pelvic floor muscles were stressed and, what directly happened to those. Maybe was there any tearing? Did you have an episiotomy? That's all going to affect what that recovery looks like. Whether there was any trauma potentially from maybe an emergent situation, and something to keep in mind too is that trauma is really, it's in the eye of the beholder, right? So it doesn't always have to be that something went wrong or, maybe even looked emergent on the medical side of things. Just birth in and of itself can be a very traumatic experience for a woman. So it's important to remember again that both the mother and the baby is recovering, right, from this experience. So the mother's recovering from gradual change and also recovering from the birth of their baby, which relatively speaking was, a quicker event. So you kind of have these two things, one that was developing over time and then one that was just relatively quicker that you'd be recovering from. There may be a tendency to underestimate those gradual adaptations the body went through during those 9 months of pregnancy. Even if you weren't in pain or discomfort, and then on top of that, you had this acute incident that was birth. So it's certainly an amazing process, and it could be just potentially easy, again, to focus just on the new baby that arrived. But we want to make sure we highlight that the journey that the mom's going to continue to have after birth. All right, so this next slide we entitled New Baby, New Demands, No Time, because having a new baby brings on a whole new set of duties and activities. We say it's truly an on-the-job type of training because, some things are new, some things are old, but it's just fair to say that even familiar things that you've done maybe over and over and over again, maybe without difficulty, they're just different now because you have this thing that you have with you all the time. So even if you're a mom who maybe you were really great about exercise and you were doing strength and endurance training prior to this and all throughout your pregnancy, you likely were not practicing, with a 7-pound baby or object, let's say, in and out of a car seat, on and off a boppy, or just carting it around your house maybe. So the mere repetition and, prolonged periods that you're doing some of these things, that can really be the perfect recipe for repetitive strain and stress that can lead to not only pain or discomfort, but just movement dysfunction, which is gonna affect your whole body. Not to mention, again, initially, you're probably not, focusing on yourself. You're probably, initially, did they eat? Did they, are they peeing enough? Is that poop normal? Whatever it is, like what day is it? Because it's a little bit of a fog, but you might not be paying so much attention to yourself, and maybe even asking yourself like, hey, what did my form just look like when I picked up my baby? That's probably not the first thing on your mind. So we just want to offer some tips as we go on of maybe some things that you can work into your day. All right, so these are some common complaints and diagnoses for mothers that are postpartum. So this is, again, not an all-inclusive list, but these issues can stem from what occurred during pregnancy, during birth, or even after with caring for the baby. So urinary incontinence, that is the involuntary leaking of urine, low back pain or pelvic girdle pain, dyspareunia, which is painful sexual intercourse, pelvic organ prolapse, which is when the muscles and or the connective tissue that supports all of our pelvic organs, so things like your uterus, your bladder, your rectum, they can actually, that connective tissue or those muscles that support that, they can become loose or weak, and in turn, the organs actually drop or protrude. Some symptoms that a woman would experience, they might feel heaviness or pressure, a feeling of like falling out. That might be something that they're experiencing with that. Diastasis recti, so it's kind of a hot topic right now. Not that it's new, but a lot of people are talking about it on social media. So this is where there's a separation of the abdominal muscles. So we talked a little bit earlier about that rectus abdominis, which goes from the bottom of your sternum down to your pubic bone. With birth, with the belly growing forward, there can actually be a spread or a separation of those muscles, and they may or may not go back to what it was like pre-pregnancy, and you could have some symptoms with that. Some neck and shoulder pain, maybe from those new demands of motherhood and posturing during everyday tasks. And then lastly on this list, but certainly not least, we have postpartum depression, which just a side note, in a study, it was actually women who had back or pelvic pain during pregnancy were 3 times more likely to have postpartum depression. So this is something that is beyond the baby blues that you might experience initially right after having the baby. And you might notice that different individuals that are on your healthcare team are screening for it. There's some validated screens that you might be answering questions on. I know some pediatricians do this at your visits, which is great. Your OB, some PTs will incorporate that in if you're seeing them. It's certainly not something to overlook. It affects about 10 to 15% of mothers after birth. And just with this, I know I don't want to go too much because I want to give Natalie time, but with all of these things, I want to emphasize that just because you had a baby and you are now a mother, which is awesome, it doesn't mean that you have to accept that this is your new reality and I just have to live with these symptoms and there's really nothing to do about it. It's, what do you expect? I'm a mom. These are all treatable conditions, right? So it might not be treated by perhaps someone you've met yet, but these are all treatable conditions. So with the right interventions, with the right resources, with the right referrals to the right providers, you might just have to ask, hey, do you know anybody that treats this? Can you refer me? And at the end, we'll have some resources, and certainly you can ask us for referrals as well. Maybe we can help you. But I'm going to pass it over to Natalie on the pain experience.
Okay. Thanks, Jenna. That was great. And so pain and pain science is a really interesting topic. We could take a whole weekend talking about it. And the reason we're highlighting it is it is part of what you may be experiencing postpartum, and we want you to understand all the factors that contribute. So this slide is a bit busy, but it does help you get a sense of all the different contributing factors and how they may influence to how we individually experience pain. So some of you may know that pain occurs when the brain determines that information is coming its way is threatening. And the brain uses information coming from sensors all over our body, and then it relies on other information, such as our previous experiences, to make sense of the incoming input. So your brain kind of says, is this something I should fear? Is this something I have had before that has caused pain? And our brain does an amazing job integrating all of this information to then output a pain signal. The challenge comes when other parts of our body or brain become taxed, and our general nervous system is on overdrive due to things like increased stress, lack of sleep, poor nutrition. I'm sure this sounds very familiar if you're a new mom. So our brain has a hard time making sense of the incoming information, and we may experience something that is painful, but we actually haven't caused any tissue damage. And that's a really important piece to keep in mind, because sometimes it's the fear of the unknown. What did I just do? That actually heightens our pain response. So I'm going to explain a little bit more here. So for example, when we touch a hot pan, the sensors on our hands send the message to our brain. The brain processes this incoming information and recalls, yep, I've burned myself before, and yes, pans tend to be hot. So we experience pain and draw our hand away. So real tissue damage has occurred, meaning we burned our finger and there's something going on at the tissue level there. And our brain has responded by having an experience of pain. So here's another example. Let's say we're walking across our living room floor and we step on a pacifier. This also shouldn't be a new experience for many of us. And we scream with pain. It's like, oh my gosh, what happened to my foot? Now, certainly stepping on a rubber pacifier has not caused tissue damage in our foot, but why does it hurt? What happened? Well, it's because the last time we stepped on something on the floor, it was a building block. That's our previous experience being built in. And since our brain's is maybe a little overwhelmed because we only got 2 to 3, maybe 4 or 5 hours of sleep the night before, our brain is not really in any position to efficiently sort through all of the many pieces properly. And instead, we kind of just categorize this sensor, this alert, into a threat, an emergent situation. And that's when we experience pain. So the big thing to remember, because it's a really intricate topic, is that there are a lot of different pieces to the puzzle, and that experience of pain is a whole system experience, and many factors are going to play a role. Okay, so let's move on to some more of the nitty gritty. So our motherhood tips and tricks, and how do we conquer everyday tasks and movements and save our bodies? Like Jenna said, a lot of these movements we've done before, but we're doing them in a slightly different fashion. Unless you like to walk around the grocery store holding your watermelon, you probably haven't really trained yourself to do these things. So we've carried and we've lifted and we've bent before, but not in the repetition. And not with exactly the same types of movements, or maybe the same type of fatigue that we might be doing them now. So let's talk a little bit about carrying. So body position can make a world of difference. You really want to think about whatever it is you're carrying, whether it's groceries or your baby, that you're keeping things close to the body. So that can help reduce stress in the neck, in the mid back, and the low back. And you want to avoid prolonged position. So being in the same position, using the same muscle groups for long periods of time. So the key is just changing it up. Whether you're changing the baby on from one hip to the other, you're changing your grip, you're moving your elbows and wrists and hands into a different position. You just want that variety, so it's not the same type of load on the same area in the same position for long periods of time. That's certainly not healthy for our body, and certainly not something we've trained for. Using carriers, they're lovely and they're so advanced now. We don't need to just have to use them outside the home. So get hands-free and strap that baby on the front or the back. It offers just, again, that variety we've talked about, just trying to do something that's a little bit different so we don't have the same exact movement causing the same exact stress. And staggering your feet. So instead of standing with both feet always next to each other, maybe the left foot's forward one time, maybe the right foot's forward. Maybe you're sitting, or you're just trying to create a little bit of a difference so that your body can have a break in some fashion. And trying to avoid sitting the baby on a hip. I mean, it's a position I know well. Most moms know it well because it creates one hand that's free. That's great and needed a lot of the times, but the key is switching sides, and then maybe using a carrier. Again, the whole idea is variety. Using bouncy seats, putting the baby down on the mat. That's good for everybody to take a break. I had a very colicky first child, so I know what it's like to not put a baby down. But I think sometimes I wish I had done it more and been like, everybody's gonna be okay. Because your body really needs that. Even from a stress standpoint, you just need some of that time away from having to constantly manage. Okay. I'm just making sure I covered everything there. Okay. And one more thing I'll say on this slide, and this kind of goes for the next few, is try not to have your mindset of toughing it out. The positions and movements you have to do are so repetitive. We do them again and again and again. So you want to, if you can make yourself more comfortable with something, do that. If you can change your mechanics slightly, go ahead and do that, because there's plenty of movements that are awkward. There's no ideal way to do it, and you still have to do it. So if you can take the activities and motions that have some variety and that you can vary and change, go ahead and do that, because it is going to help decrease the toll your body takes. So feeding and nursing, there's different positions. You kind of have to work with your baby and figure out which one works for you, which one works for the baby. The key is, once you decide the position, you want to support the spine. And so if it's sitting, you have a pillow behind your back. You're kind of upright. If you're lying on your side, you're making sure your head and your neck are supported. But you want to make sure that you're supporting the position that you're in. Use lots of pillows to support the baby and you and your arms. So trying to bring the baby to you, not your breast to the baby. And this was like my go-to position. I was always like fishing around trying to nurse my child, like bringing the breast to them. And my neck and back were like killing me. And after a while, I was like, everything has to come up, because can't get low enough sometimes, but you're doing that all the time. And if you can make a few adjustments, it really goes a long way to just save your body. So bending and lifting. You always want to make sure you're bending as much as you can through your legs, and keeping the back as straight as possible. So you can see Jenna's yes and maybe not positions is that we really want to bring our body to either to the baby or to the item that we're bending toward. And when you're bending down to perform a task that will require you to be in that position for a while, and this is kind of the fishing through the diaper bag motion, try to go into a half kneeling position or go into a deep squat or lift the opposite leg, just so that you're not in that forward bend and loading that spine for a long time. You can think similarly about lifting. You want to get as low as possible, bend with the legs, and lift the baby or item up toward your chest and holding them again close, the way we talked about carrying, keeping them close to your body, close to your center of gravity. And then when you're returning to that position, using those legs. If you think about the areas that have been taxed in your body through pregnancy, like your abdominals and your low back just went through a lot, they're not going to be strong. So why are we asking them to hold all the weight? Use your legs. They might not feel strong, but at least it's going to be more body aware more. It's going to have better mechanics associated with that, and you'll strengthen your legs a little bit through the process. So car seat holding and lifting. The truth is there's no easy way to carry a car seat. They're awkward. Some folks have tried an alternative car seat hold, and you can see that image in the circular picture of Jenna. She's kind of initiating that position, trying to weave her hand through. And it can put less stress on the forearm. But the truth is you got to do what works best for you, as long as you're not holding that car seat on your forearm in the same position for long periods of time. Change arms, put the car seat down, strap it into a stroller. It's just that we're going to be doing this tomorrow and the next day and the next day. And you want to make sure that you aren't ignoring the fact that you're loading your body and stressing your body the exact same way without attempting to create some variety. The price we pay, and this poor woman looks like she's in a lot of pain. Inefficient and bad movement patterns are not sustainable. And over time, they will add up. Your demands as a mom will continue. You'll have lots of other different types of tasks, but it's a physical job, especially at the beginning. And you don't want to start off on the wrong foot by compensating and abusing your body, especially if there's ways you can make small changes to save your neck or save your back. Your growing child will make it very evident that you can't continue with the compensatory strategies and bad movement patterns after a while. Like they're going to be moving more, and you just want to be able to know that you've made good decisions up to the places that you can. And obviously there's a lot of non-controlled variables there, but trying to move poorly and hope that that just keeps working, eventually something's bound to break. There's just too much repetition happening for your body to be able to sustain bad movement. So investing in good movement patterns will definitely pay off in the long run. And especially as we talk about getting back to exercise, it may be the small thing you can do now that'll actually set you up to be able to get back to some form of physical activity with a little less discomfort. So postpartum exercise, we're kind of transitioning from the day-to-day now to, I want to move. Let's get going here. There are a lot of reasons to get moving. Oh, are you with me, Jenna?
Yep.
Okay. And here are a few. So improving cardiovascular fitness, decreasing stress, risk of stress urinary incontinence, like Jenna was talking about, decreasing your risk for anxiety and depression. Also, Jenna mentioned that's, 10 to 15% of women experience that. So there's something to, getting yourself moving is really good for your mental health. Reducing your risk for future chronic disease, such as diabetes and high blood pressure. So I'll hand it back to you, Jenna.
All right. Thank you. Can you hear me fine?
Yes.
Okay. So before we dive into some guidelines on returning to exercise, we thought it would be important just to note that traditionally speaking, somewhere around 6 to 8 weeks postpartum, you're likely going to have a follow-up with your OB/GYN or whoever your obstetric provider was. With the new recommendations that ACOG put out in 2018, perhaps you've already experienced a new kind of ongoing process, which is awesome. I don't think it's universal yet across the board, so you might fall into one of these two. So maybe you've had, whether it be on the phone or some kind of checkup before that, but eventually you're going to have that single visit where there's a more comprehensive exam from your OB. And, that in-person visit, they're going to be looking at your social and psychological well-being, how infant care is going, your mood, sleep, fatigue, and really honing in on like how your physical recovery has been from however method you delivered or birthed your child. So whether it be C-section or vaginal delivery, they're going to check up on incisions and potentially tearing and just see how everything's healing. All of these are necessary components, so definitely go to those visits. I actually read something that only 40% of women follow up with their OB or obstetric care provider, so it's very important. But at this point, if all the healing is going well, you might be given, told that, and then be given the kind of okay to start gradually ramping up exercise. Like, okay, you can start kind of pulling this back into your life beyond the physical kind of day-to-day activity. This is just where we would like to further emphasize just it's not intended to be like the thumbs up, like all clear, go for it, and just really try to emphasize that word of caution, not to put fear, but really because for some women diving right back in or even gradually going, it could be very linear and they can be just fine, and that's awesome. But then for many women, maybe they try something to kind of test the water and you could feel really discouraged and be like, wow, like this is not what I expected. Or, you're surprised at what your body can and just can't do. So we just want to unpack that a little bit and just throw that out there because there's a lot to think about when you're heading back in. So let's just unpack that a little bit and talk about just recovery timelines. So recovery timelines are very variable for all things, not even just for pregnancy. So even if you've experienced physical therapy before or an injury before, it's not cookie cutter, right? Like it's not always just, 6 to 8 weeks, I'll be back, because that's what the tissue is supposed to be doing, because there's just so many factors, as Natalie talked about. Pregnancy is unique, the birth experience is unique, and recovery is unique because the reality is soft tissue healing depends on genetics, your age, extent of tissue injury, your health status, and really what you want to get back to, right? Not everybody's trying to get back to the same things and incorporate the same type of exercise into their routine. We would never as a PT rehab two different patients that are maybe had the same shoulder surgery the same. So rehabbing, different women who are mothers after birth, that's not going to work either. So what's so special about 6 to 8 weeks? So in general, and again, I'm stressing this is generally speaking because I don't want people to hold me to this, but many of the effects from pregnancy that occurred on the body system, so for instance, like your uterus and how big it expanded, a lot of those systems that we discussed earlier in the presentation, they've at this point are close to or have already returned to their pre-pregnancy state. And then when you talk about soft tissue healing, which again has to do with those muscles, those ligaments, connective tissue, in general, at 6 to 8 weeks, soft tissue has entered or is about to enter what we call the maturation phase. So that's where the tissue is just getting stronger. So like the collagen, which makes up some of that scar tissue, it's able to take on a little bit more load, right? So safety is always going to be number one, but you want to make sure that you're just understanding the importance that successful rehab involves gradual loading to allow tissue adaptation, because that's how we get stronger, the tissue is adapting. And then we're also making sure that we're monitoring the response, right? So if you do something and you're like, ooh, that didn't really go so well, you have to listen to that, and then also make some adjustments, depending on what that looks like. There's somewhat of a science to this, right? So like just exercise in general, there's science to being able to ramp up and get results. So we can apply those to this phase as well. Being capable, determined, and just toughing it out, of course, like you could do that, like no doubt, but that's really different than being functional, being healthy, and being comfortable, which is what we would advocate for. And this is just a reminder that that full return, it takes time, and it really might not be a linear path for everybody. It might kind of take some turns and have some ups and downs. So considerations for returning to postpartum physical activity and exercise. ACOG, again, they actually updated a committee opinion on physical activity and exercise during pregnancy, as well as the postpartum period. They updated it this year in April. And, you know, just to emphasize again that resuming exercise, it's going to be highly variable, and there's really no definitive time frame. There's a lot of factors that will play into this. Some that you have control over, and then some which you either have very little control over, or maybe you don't have control over at all. So some of the things to consider are going to be your pre-pregnancy and pregnancy fitness level. So what were you doing even before you got pregnant? You know, what were your activities like? What was your fitness level like? What did you do during pregnancy? Because the longer that it's kind of unfair, even outside of pregnancy, that, you know, it takes a really long time to build and see change when you're talking about strength and endurance and cardio. But unfortunately, like losing it happens very fast, right? Like deconditioning in general, not just pregnant women, happens way faster, and that's just the reality. Your energy levels, your fatigue. So, you know, that's something to listen to. You might feel tired, and you might do exercise and it could energize you. You can feel a lot better, as Natalie talked about all the potential benefits, even for mental health and emotional health. But you could also be pushing through and feel worse. So listening to your body is very important. Your time and your schedules, right? So right now in this time, it's a little wacky. So you might be trying to like work and be a mom at the same time. And it's really tough to negotiate those things, but you want to keep those things in mind. Your adaptation to your role as a new mom. So all those things that are new that you're having to do, they take time, right? I remember just cracking up and crying over the fact that, wait, I'm supposed to feed this child every 2 hours, but the clock starts when I start. Like it doesn't start when I end, because I'm like pushing an hour and 45 right now. And like, there's just no time. So anyways, making jokes, but the truth in that is there's just a lot that is new and a lot you're adapting to. You know, do you have any pain or discomfort? And again, yes, you certainly could just tough it out, but at what expense, right? Like over time, that is probably going to be problematic. And, you know, we would always advocate for pain-free, because that's what's going to help you move better. You know, what's your childcare situation? What's your return to work timeline look like? Again, it might look a little different right now in the time that we're living than it would maybe previously. And then, you know, do you have a condition that maybe needs medical clearance? So not an exclusive list, but if you had preeclampsia, or, you know, a significant vaginal or rectal repair, or some kind of liver or renal failure or involvement during pregnancy, or essential hypertension, you want to make sure that you're checking in medically that it's safe for you to exercise before you just get back. Okay, so 2 little myth busters. I'll read to you. So the first one is, the speed in which I get back to exercise postpartum will influence what full recovery looks like. That is false. So, you know, a lot of us are eager because it's been a while maybe since we've been able to do some of the things that we previously were doing. But it's sometimes important to just remind yourself that you don't have to rush to get back to it. You might want to, but it's not that you have to, that you're never going to get back. Regular aerobic exercise in lactating women has been shown to negatively affect milk production or composition. So this is also false. I know some people might be concerned that, well, if I exercise to a certain level, that I'm going to affect the milk for my baby, and that wouldn't be good. But it actually doesn't negatively affect it. All right. So I'm going to try to be concise because I could totally geek out on this like all day. But a quick little note on the core and pelvic floor exercise. I'm going to hand it back to Natalie after this, just with more tips from her. But as PTs, like we love the core, right? You've probably heard that word a billion times, even if it wasn't from a PT, maybe from your trainer, maybe just from reading stuff. But we, meaning like the world, we might have a tendency to kind of overuse that word core to mean more than what it is, or maybe not represent all of what it is. So I just want to chat a little bit about what the core is, because again, like a lot of times people can think it's just the abdominal region, but it's really so much more than that. So the core is not only made up of 4 different sections or areas of our body, but these 4 sections actually have to properly function together. So for instance, like if the right hand isn't talking to the left hand, or if the top isn't talking to the bottom floor, then there could be some issues. So they really have to be able to work together to be able to help you have healthy movement and healthy function. So I think you could see my cursor, but hopefully. These are the deepest layer of muscles, like our true core, the deepest layer of muscles. It's not our like 6-pack muscles that we're trying to make look good when we wear a bathing suit. So these are, the first muscle I'll talk about is your transverse abdominis muscle. So it actually, I know this is a 2-dimensional picture, but it starts in the spine, and it's this one right here. It's kind of that, in this picture, an oddly shaped like rectangle. It starts in the spine and it actually wraps around to the front, and it's like a corset, right? It's like our very own back brace that we have. And that's what it does. It actually really supports our spine and supports our organs. Then you have these tiny muscles in the back. They're called our multifidi, and they're just really small, and they're between each little vertebrae. Then on top, you have that diaphragm, which is again, that dome-shaped muscle. And what happens with this, the diaphragm is closely related to our breath. So when we take an inhale in and breathe in air, the diaphragm contracts and actually drops down to let air come in. But with pregnancy, what happens is it actually gets pushed upward, and sometimes it doesn't really know how to contract right after birth. And we have to retrain that to make sure it's working properly and efficiently, so it can make sure that you're having a good core contraction. And then lastly, we have our pelvic floor muscles, which is down here. So they span from our tailbone here. It's kind of like a sling, like a hammock, and it goes to our pubic bone. So, you know, if you've heard people talk about Kegels before, those are the muscles that are contracting when you do that. So ACOG, we love them. They put out in their paper an opinion about, for uncomplicated pregnancies, initiating or resuming pelvic floor and deep core muscle isometric. So that's just when you're like tightening them. There's really not much movement. They can occur immediately postpartum, which is great because those muscles have been potentially gradually stretching from all of the weight that you carried during pregnancy. But then during birth, they were stretching even more if you had a vaginal birth to deliver the baby. But even if you had a C-section, those muscles have been taxed quite a bit from the 9 months that you were pregnant. So it's great that, you know, it's safe to start those exercises. But we're again just going to say a little word of caution, because it's, when it comes to pelvic floor dysfunction or even how the core works, it's not just about Kegels and it's not just about strengthening. So your pelvic floor muscles, they can actually be tight after birth, believe it or not. Even with, you know, all the stretching that occurred, you'd think, well, shouldn't they be loose or just, you know, overstretched, which they can be. But they could also have like a rebound and tighten up afterwards. And if you think about a muscle, you know, for instance, your bicep, right? Like if I told you to do a bicep curl and your elbow was bent, you'd be like, well, I have nowhere to go. Like I can't really do that. I can't generate that force. It's the same type of thing. Like if your pelvic floor muscles are really tight, like a fist, and I say, okay, well, do exercise or tighten them, it's like, I can't really do that. So it is important to keep in mind that sometimes we have to actually do exercises to relax the pelvic floor muscles in order to get them to work efficiently and contract right after. And you also, if you're having any pain with any of these things, that's a strong indicator that you shouldn't do Kegels yet, because you have to do other things first. We talked about the diaphragm. Again, it can be pushed upward, and sometimes we need to do exercises to incorporate breath and reteach that diaphragm how to drop down and how to get that rib cage movement again, just from where it was living during your pregnancy. Poor coordination or quality of contraction of any of these muscles, they can just reinforce bad patterns and really not support you enough when you're doing your everyday functional movements or your exercise. And it would be, it's advised if you have a trained professional, someone, maybe a pelvic floor specialist, maybe an orthopedic PT, they can assess these muscles and they can look at different things like tightness and strength and coordination and endurance, because these are all different things of how muscles should be able to work to be activating and coordinating properly, but then also be able to tie that to like what you want to get back to. And from that, just develop a plan that's really going to work for you. Okay, I will get off my soapbox and hand it back to Natalie.
All right. Yeah, that's great. Well, it's important information for everybody to understand. I think a lot of times it's we have a false sense of understanding what the core is and those muscles. So I'm glad you spend the time, because I always pick up some new tip. And so we're moving on to just increasing physical activity. And so I know Jenna was kind of saying, she was handing it off to me. And so I'm not going to dive deep into core exercises and things like that. Jenna was just giving the background so we all have a better understanding of it. But truthfully, in order for you to have a proper exercise prescription, you need to really be evaluated. It's not just we're desperate to give you all something to go home with. We also don't want to mal-prescribe things for what your complaints are that might not be appropriate for you. So I'm going to talk on a more of a bird's eye level about increasing physical activity. So like Jenna mentioned, everyone is starting from a different place. We all have different bodies, different pregnancies, different births, and different previous levels of fitness and different levels of fitness during our pregnancies. And just kind of a side note I want to say is oftentimes people feel, well, this was my level of fitness and this is my image of myself and my fitness level. And then we enter pregnancy and it's maybe a little different than we thought. And then our recovery looks even different than we thought that would look. And so I think just trying to understand that there's no perfect algorithm, like being super fit and super strong before a pregnancy doesn't ensure that you can maintain that type of rigor through a pregnancy. And it does potentially not a lot to do with how you recover, maybe what your body's capable of rebounding to at some point. But I think trying to help people understand that that recovery period, it just looks really different. And there's no magic way to set yourself up to have the easiest possible recovery and get back to what you want to faster than anybody else. And I think it's a hard concept, because I remember thinking during my pregnancy, well, why can't, I like to run, but I don't feel good running. I'm just going to keep running because I got to be fit through my pregnancy. And I remember early on, I was like, I'm not doing this anymore because it doesn't feel right. And even though I think of myself as being someone who is fit or likes to run, this just not working for me. And instead of being mad at myself that I couldn't do what other people could do, I just thought my body's telling me something. And for me, this pregnancy is just not going to tolerate that form of exercise. So I have to find something else. So, and that's, we have to just accept how our body is going to look through pregnancy and how it's going to recover. And we have to just meet that particular body for that particular pregnancy, postpartum, where you're at. So initially starting with something really, simple like walking may be great. And slowly you can increase your distance or time based on your fatigue or comfort. The key is monitoring yourself both during and after the activity to decide, was this tolerable? Was this something that was appropriate for me? Even mentally, if it feels like that doesn't feel like enough or it feels simple, take a check. later to figure out, like, did my body actually tolerate that? Even though my brain's saying like, no, I'm good. Did my body actually do well with that amount of work? Pressing forward without your body being ready for change, for the challenge, like Jenna mentioned, does not get you to recover, and you're not going to get fitter faster by just pushing through pain. You're not meeting, I mean, from an educational standpoint, we would never ask someone to do algebra before they knew how to add. So why are we expecting our body to just make that leap of faith? Like, I could just do it because I think I can and I want to. Just, we have to really be honest with ourselves and what we're experiencing. Monitor your fatigue and energy level. It's going to be different on every different day. So you have to use that as kind of a gauge to determine what's going to be right for you. And it's important to note the signs of doing too much. So if you're having increased bleeding, that's kind of an obvious one. Like, okay, my body's telling me I stressed it too much. Pain might be another one. Like, okay, I have pain and discomfort in my back or my pelvis or my legs when I do this exercise. And I should take note of that and make some adaptations. Success begets success. That's one of my favorite expressions I use with my patients. Your body will improve, but it can improve in a more linear way when you build on positive experiences. So give yourself something that you can achieve, and then the next time you can achieve a little bit more. But if you're constantly overshooting, crossing your fingers, hoping for the best, it's really deflating when you feel as though, like, oh gosh, I can't do that. And like, how am I ever gonna get to this other level? So you have to just take it one step at a time. And every time you have a successful physical activity, that's a win. And you can build on that positive momentum. So fitness fundamentals. Health and fitness is not a long-term, is a long-term investment. So we're not trying to make up for the 9 months of not working out or having modified workouts in one workout. That's just not going to happen. You're not going to get fit in a day or a week or a month. And beating yourself up or pushing through the pain is not the way is not the right approach, not the way to get there. So when you're beginning a new exercise routine, you want to think about going slow, adding some variability, make realistic goals about what you want to achieve or what you're going to look to achieve this particular week or particular month. And you can use these FIT principles. So the frequency, how often, intensity, how hard, the time, the duration of the activity, and then the type. So is it walking or swimming or elliptical? And so you want to change just one of these variables at a time, but these variables will help you kind of figure out that stepwise fashion to progressing. And you don't want to start messing with a lot of variables because it's hard to then build on the success. And in order to kind of add one thing at a time, it's just focus on one of those variables to adjust. You want to start with doing the basics. You know, you want to be able to do a squat before you do a squat jump. You want to be able to do a squat before a single leg squat. So trying to progress without being able to do the basic form of the exercise is, you know, it's ill-informed. You want to make sure you're actually able to accomplish something in its raw form before you try to make it more complicated. And more complicated or fancy exercises don't make you more fit or stronger. And honestly, they put you at a higher risk for injury because you're going to compensate. If you're not able to do the basic form of something, if you try to do a higher level activity or exercise, you're going to probably compensate somewhere, which could cause injury. Modifications are not cheating. They are the stepping stones to help you progress in an appropriate and linear way that's appropriate for your body. Modifications are there for a reason. You want to use them as ways to then accelerate your abilities. Exercise with the mindset of wanting to feel good. That's going to help build consistency and motivate you to continue. Sometimes you can do really simple things and the benefits are surprising. It's like, wow, this gave me a lot more energy, or, oh, my upper back feels a little less stiff. I didn't realize I was holding so much tension there. So that's really the things to focus on, because there's no prize for doing more sooner. I promise you, your child won't buy you anything fancy. And exercising and taking care of yourself should feel like a reward, an enjoyable time. If you're taking that time away from your other duties, as a mom, you want to make sure it's something you like. You don't need to punish yourself some more for something else. You know, that's a time to recover, and choosing a mode of exercise that really kind of fills your cup is going to be important. So another myth buster here, doing more difficult exercises, even if I'm in pain, will make me get fitter faster. And I think I've kind of already touched on that topic, and that is definitely false. So overcoming barriers for return to exercise. Jenna kind of highlighted these as far as before, and this was an article written in 2003 that highlighted some of those same themes about how to get back and how to return to exercise. What are the key things that we need to move us forward? So having social support at home, having assistance with household tasks and childcare, having some verbal support from a spouse or family members and friends. That encouragement goes a long way. Consider arranging for workouts immediately after feeding. There's nothing quite so frustrating as trying to get a workout in and all of a sudden the baby's crying and you're thinking like, okay, I feel like I need to feed, so I'm pretty uncomfortable and the baby's crying, but I really want to finish this. So if you can kind of plan ahead a little bit, you might buy yourself a little more of a luxurious experience if you've already fed. I guess I shouldn't use the word luxurious, but I'm going to because it's nice to say things like that. And then consider joining an exercise group or class, because having a nice support system, a community of people that you can relate to and talk about your experiences and your challenges is really helpful. There's a group in our area, Fit for Moms, that offers group exercise just for mothers. So the whole thing's tailored just for moms, which is great. But lots of different places nowadays are having classes that are just for moms. And the nice part is you can access them virtually. I mean, this is a crazy time, but the one piece that might be helpful to new moms is that now you can access things from your own home, hopefully at the times that work for you. Okay,
so Natalie, I'm just going to interrupt. I promised you guys I'd give you a heads up. It's 1 minute to 2.
Okay, this is going to be my last slide here. Thank you for the heads up, Gwen. So what can you do now? So you want to have someone, preferably a trained professional, take a look at some of your everyday tasks, watch your mechanics. Even if you're not in pain, it might be something that helps prevent dysfunctional movement or pain later on. Consider checking in with a physical therapist, even if you don't have pain, to ensure that your pelvic floor muscles and deep abdominal muscles are working properly. Kind of to Jenna's point, they've gone through a lot. So as much as things kind of rebound and heal in miraculous ways, we also want to make sure this area that's been especially stretched and taxed during those 9 months actually is able to function the way it's intended. See if you can set aside at least 15 to 20 minutes of you time, even if the sink is full, even if you have no clean laundry and the house is a mess. Close your eyes and just ask yourself, what's the one thing you can do for yourself? What's the one thing I can do for me today? And try to make that happen. If you do have pain, rarely there's a quick fix or magic bullet, but there likely are several things you can be taught to do on your own. And like Jenna mentioned before, there's a lot of common complaints postpartum, but that doesn't mean there aren't resources out there to help you. So the key is just trying to find those resources, find that specialist, keep asking people, keep asking your healthcare professionals about who can help you with this. And if the first time doesn't work with someone, try someone else. But there are people out there who can help you. The key is just keep searching for the right fit. And then we talked about kind of restorative movement, and sometimes a really simple thing can go a long way. And so this next slide here is me attempting, you can see I'm quite stiff there. So, but this is a seated thoracic rotation. So a lot of the times in motherhood, we're down, we're forward. And so this is a nice way to kind of open up the chest. So you can even practice this if you're sitting somewhere in your home, find a stable chair. I'll kind of show a little example real quick just to see real time what it looks like. Hopefully I have enough space right here. But but you're bringing your hands down toward your knees, and then you're trying to open up and try to stretch that chest and try to work that upper back, because our upper back takes a lot of the stress of carrying, nursing, holding that baby. So this might be a nice, very simple restorative type of stretch. You try it on one side, hold it for, anywhere from 10 to 25 seconds. You can hold a little longer if it's comfortable, and then you try it on the other side. You might be surprised at how different left to right is. And that might correlate with what side you like to hold that baby on. Motherhood is a marathon. It's not a sprint. I think we're saying a lot of the same themes about taking care of you is so important. You've got a lot of tasks ahead of you, and it's a wonderful job, but it's important to make sure you're taking the time to keep you healthy and keep your spirits up and keep you moving. We've got some resources here, different exercise group, local support groups, breastfeeding support groups, and Jen and I are happy to give you more information if you feel like you need some more resources, or if you have specific questions and you need to figure out the right specialists to help you address that.
Thanks, you guys. This has been great. We do have one question. I've told the attendee that we'll make sure that one of you gets back to them with an email answer, because I know you both need to hurry off. So thank you, all of you, for being with us this afternoon. If you do have any other questions, feel free to submit them via the Q&A, and Natalie or Jana will be happy to respond to them via email.
Thank you, everyone.
Thank you.